What is the link between traumatic brain injury and brain atrophy? Have you ever wondered how a traumatic brain injury, or TBI, can affect the brain long-term? Traumatic brain injury is a major cause of brain damage that can lead to brain atrophy. Brain atrophy is the loss or shrinkage of brain tissue over time. This connection is particularly important because brain atrophy is often linked to dementia and memory loss, which are common concerns for many people. The link between TBI and brain atrophy primarily involves damage to brain cells and their connections. One critical aspect of this damage is to axons, which are the long fibers that transmit signals between neurons. When a TBI occurs, it can cause traumatic axonal injury. This disrupts communication between neurons and triggers a series of cellular processes that lead to neuron death and tissue loss. Researchers have identified biomarkers, such as neurofilament light chain, that increase in the blood after a TBI. These biomarkers can help predict the extent of axonal injury and the degree of brain atrophy seen in MRI scans. After a TBI, brain atrophy often affects areas vital for memory and cognition, like the hippocampus and cerebral cortex. This loss of brain volume can lead to cognitive deficits and memory issues, increasing the risk of developing dementia later in life. Studies show that individuals with repetitive head impacts, such as athletes, may experience accelerated neurodegeneration and brain shrinkage. From a biological standpoint, TBI-induced brain atrophy involves several mechanisms. There is direct mechanical damage to neurons and axons. Additionally, secondary injury processes like inflammation and oxidative stress also play a role. Supporting cells, such as microglia, can become dysfunctional, failing to clear damaged cells effectively, which worsens tissue loss. Altered neural signaling and impaired repair mechanisms further complicate recovery. The degree of brain atrophy after a TBI can vary greatly. Factors like the severity of the injury, the number of injuries, age, and genetic predisposition all play a role. Importantly, brain atrophy may not be immediately noticeable. It can take months or even years to progress, contributing to chronic cognitive decline. For those worried about dementia and memory loss, understanding the link between TBI and brain atrophy is crucial. It emphasizes the need for prevention, early diagnosis, and management of brain injuries. Rehabilitation strategies can help support cognitive function. These may include physical therapy, cognitive training, and medical management of symptoms. Ongoing research is focused on finding better ways to track brain changes after a TBI and develop targeted interventions. In conclusion, a traumatic brain injury can set off a chain reaction leading to brain atrophy, which contributes to memory loss and an increased risk of dementia. This highlights the importance of protective measures against head injuries and the need for comprehensive care for those affected.